Hi, my name's Lucy Gillespie. I'm a registered nurse with a background in surgery and admissions nursing. For the past 6 years, I've been working in nurse education and supporting newly qualified nurses in practice. In the last couple of years, I've moved into a practice development lead role in the Institute of Nursing and Midwifery Care Excellence, and the focus of my role is on recruitment and retention. I currently work at Nottingham University Hospitals. The purpose of this presentation is to talk to you about an intervention we've implemented at Nottingham called resilience-based clinical supervision. The purpose of the intervention is to focus more on the pastoral support we need to give to our newly qualified nurses. We recognise that for newly qualified nurses, we have a great programme of education and clinical support, but we need to invest further in the pastoral support to keep them and to retain them in our workforce. The aims and objectives of the intervention are therefore to support our newly qualified nurses to deliver exceptional care to our patients and to have great pride and value in the things that they do. We want to promote self-compassion. As nurses, we're brilliant at looking after our patients and having compassion for our patients, but we lack compassion for ourselves and our colleagues. We want to reduce sickness and attrition related to workplace stress, and we want to increase retention of our newly qualified nurses during their first year in practice. For the purpose of resilience-focused clinical supervision, we worked with the University of Nottingham on a pilot supported by the Burdett Trust back in 2017. We've been delivering resilience-based clinical supervision as an established programme of support since 2018. The implementation of the intervention wasn't straightforward. We had to establish a new way of working that focused on the things that might have been seen as perhaps the more fluffy side of supporting staff, which isn't always well received. We needed to think about it in a way that would remove these nurses from our clinical areas and give them time and space to reflect and think about the processes that they're going through and the care they're delivering. We recognised that for our rotational staff, that they did not only experience transition when they first started into their professional role, but actually as they moved through clinical areas and perhaps at the end of 6 months moved into a new clinical area, they would somewhat regress into some of the issues they experienced in original transition. And we wanted to support this group further with that experience. We invested heavily in our key stakeholders, bringing them on board and talking about the outcomes and the possible things we could deliver as part of this supervision. It evolved over a period of time, and now we have a programme where we deliver these sessions every 6 to 8 weeks with our newly qualified nurses. We also implemented alongside these a workshop style teaching session, which we focused on those things that the nurses regularly brought to supervision. This was a proactive way to use education to support them through some of those anxieties. The grounding exercise at the beginning of the session is key to engaging the participants in the session and also making them feel at ease. On a personal level, I found some of the mindfulness techniques quite difficult to deliver to a group of newly qualified nurses, and I have chosen to look at that quite differently and implement it as an opportunity to distract them from the busyness of their professional workplace lives and actually give them an opportunity to think about something for a few moments that's just purely one thing and maybe about them. The ground rules for the sessions are equally as important, and establishing these at the beginning of the session so that everybody feels that they're entering a place of safety and able to speak is really important. At the beginning of each session, I will always establish these ground rules and explain to the participants that whilst everything in the session is confidential, should I be concerned about them, their safety, or patient safety, then I would be looking to escalate the situation, but empowering them to do that alongside me. Ground rules are also important around being non-judgmental and listening to what their peers may have to say. It's really important that people feel heard at these sessions and valued. The sessions are structured, and this is important so that everybody has an opportunity to speak and has a voice. And all of the sessions end with a positive takeaway that each person will feed back to the group as something that they're taking with them from the session that will help them over coming weeks. Interestingly, the themes that we visit at these supervision sessions have started to be recurrent, and they're the things that newly qualified nurses will talk about in terms of their fears of transitioning into new roles. They are very much about clinical confidence and competence. They're visiting things like medication errors, things like pressure from other colleagues around the way that we do things. Quite often, people will bring something that's traumatic and be able to talk about that experience and how they nursed through that experience and seek support of their peers. Very regularly, we'll talk about how we fit into teams, work cultures, and team dynamics, and how we can help establish ourselves within our teams and the responsibility and the role that we play in that. These nurses often worry about what people expect from them, but also their expectations of themselves, and how much pressure these newly qualified nurses put on themselves to be able to deliver the exceptional care that they want to deliver on an everyday basis. They will regularly discuss perceptions of failure, where they feel that they have not delivered the care that they wanted to when they set out to deliver. But they will also bring positive stories. We don't ask for people to bring negative things. We ask for people to share experience. And we will also see experiences where nurses are talking about things that they have done, experiences where they have delivered exceptional nursing care and where they want to share that pride with others. The key themes from the evaluation of these sessions: structure around 3 areas. These sessions are a time to learn with fellow peers, and this is really important when we're working in a clinical environment that is so fundamentally busy. To actually have time away from that area to be with others and to learn is really important to them. The second theme is around support for each other and how they're able to share experiences and thoughts in an environment where people will listen and they won't judge them. And the third area is around reaffirming. I'm not alone and I'm not the only person to feel this way. I think this is probably the strongest part, and you can see it in the room when it happens. You can see the look of relief on their faces when someone talks about an experience that they relate so strongly to. And even if it's not something that they relate strongly to, the support that they want to give to that person because they recognise that it's something and a process that they're going through. Comments that we get through feedback, and you can see some of these comments here on this slide, are often about how they've established themselves in these sessions, felt valued, but also come away thinking how far they've come. So as they're coming to their latter sessions of supervision, looking back and thinking, this is a journey I've been on and this is what I've achieved. So switching now to the outcomes of the intervention, and there are 2 aspects to the outcomes, starting with the impact for our newly qualified colleagues. And it's great to see them personally and professionally develop on this journey. It's great to see them develop courage to challenge, courage to question, courage to explore some things sometimes that are really difficult. And also to have the confidence to do that and to go back and reiterate that in their clinical areas. They also develop a self-awareness that helps them explore perhaps why they might respond in a particular way and why others may respond in that way if they're particularly pressured by a situation, or if they perhaps don't understand the context of what they're experiencing because it's different for them. They will often feel inspired by others as they recount experiences, and they feel a real shared experience and a shared resilience as a group as they explore these stories and listen to each other. For the organisation, it's a great way to develop intelligence, and whilst it's only one side of a story, it still is a story and it's still important to hear. It helps us potentially identify hotspots for where we may need to put in additional support or additional education. And it also establishes a safety net where, if necessary, we can escalate concerns and we can be proactive around some of the things that are being brought to that session. It encourages a culture of openness. It gives our nurses a real opportunity to open up conversations and to go back and do that in the clinical areas. It therefore improves retention. We've seen that in the rotational nurses, we see a lower turnover than we do in our newly qualified nurses who are in their first year of practice. And we also see a strengthened collaboration. They want to work together to deliver care. They want to be able to explore some of the issues that they see, and they want to challenge those things. So it helps them collaborate across wards, across specialities, across divisions. So there are obvious challenges to the programme, and a lot of that is around the emotional load. So in these sessions, the nurses will explore some really quite difficult stories and difficult experiences, and sometimes that becomes a load for others. And it's really important in these sessions that they are looking out for each other and they are trying to care for each other. They are facilitation heavy and resource heavy because you do need to be able to give up time for these nurses, but they're not on an individual level, you do it in a group setting. And each session in terms of supervision takes around an hour and a half, and you would expect to do that every 6 to 8 weeks. There is also the challenge of alienating the clinical areas because you're bringing people out of their clinical environments and asking them to talk very openly about their experience of working within their specialities and divisions. And finally, there is the additional support that you need to factor in to give to the people who are supervising, because it's really important that they are supported so that they can continue to deliver supervision and that we can have compassion and care for them as well. The future of the programme is really optimistic, and we're really invested in the programme here at Nottingham University Hospitals. We are continuing to offer it for our newly qualified nurses, not just those on rotation, but all of our newly qualified nurses have the opportunity to opt in. We also use it as signposting for those nurses who the clinical areas identify, or we identify, or they themselves identify as struggling during their newly qualified year. And we encourage them to come along to supervision and feel that support from their peers. We're currently investing in cascade training so that we can train up as many staff as possible to facilitate this for different groups of people. And during the pandemic, it's something that we embedded into our international nurse training programme because, again, they're a group of staff who are going through a transition to nursing in the UK, so nursing in a completely different country. And that's something that they now have as part of their programme for their first 7 months in the UK. We also have future plans to develop and invest further the resilience-based clinical supervision to support some of the challenges we face as an organisation in our workplace culture. I hope you've enjoyed listening to me. Thank you for taking the time.